This legislation will cause many unemployed Texans to remain unemployed and will cause many Texans who currently get their health insurance at their place of work to simply lose their insurance. Employers are going to be put in a position where they will simply give up and no longer provide this benefit to their employees, primarily because of the increased costs. If you look at employers over 50 employees who are non-ERISA employers, basically the situation that they will be placed in is they will have to either meet a federal standard for coverage, many of which we believe will simply not be able to meet that standard, which will be established in Washington, D.C. And even if they do provide health insurance for their employees, but they do not meet the standard, they will be subject to a $2,000 tax per employee. So basically what you have is a situation where the average employer are going to see their premiums go up perhaps by 15 or more percent simply as a result of Obamacare, not even including medical inflation, and then be faced with an additional $2,000 tax. It's a penalty for not providing a level of insurance which someone in Washington, D.C. will decide would be appropriate. Given those facts, many employers will simply give up and drop their health insurance. One estimate by the Lewin Group says that nationwide 19 million Americans will lose their health insurance as a result of this legislation. The CBO has a more conservative view. It says somewhere around 9 million. If you translate that into Texans, that would be the equivalent of somewhere between 500,000 and over 1 million Texas employees losing their health insurance at a time when, unfortunately, Texas is faced with the highest rate of uninsured in the nation.
What this bill does really is put small employers on a level playing field. It's not only because they can buy health insurance through an exchange, which will be a large pool just like large employers have access to, but it also lets small employers attract skilled workers who right now might be afraid to jump ship and go to a small employer because they won't have coverage or they might drop coverage next year. So not only will small employers have tax credits to help them afford coverage, they're going to be able to compete on a level playing field with their large employer competitors.